And now, here is your pandemic news report.
Welcome back, everybody, to the Pandemic News Report. And today we have vampire facials linked to 3 HIV cases. CDC issues a warning. All right. So we're going to get into that right now and find out what's going on here. Okay. Let's find out what is going on in regards to vampire facials if you guys have been getting vampire facials. All right. So welcome back again to the Pandemic News Report. And let's check this out, man. So yeah, vampire facials linked to 3 HIV cases. And these are at unlicensed or were at unlicensed spas. All right. So the CDC report highlights the potential risk of HIV transmissions through injectable cosmetic services like vampire facials. All right. An investigation led by the CDC highlights the potential risk of HIV transmission through injectable cosmetic procedures like vampire facials. The report links 3 HIV diagnoses to women who received vampire facials at unlicensed medical spa in New Mexico. Cosmetic procedures, even those using microneedling techniques, are generally considered safe in licensed facilities with appropriate infection control practices. All right. So this is a warning, and you guys heed to this. If you're going to get something done, you might as well get it done right or done by someone who knows what they're doing, or a group or business that knows what they're doing. A new investigation led by the Centers for Disease Control and Prevention warns of potential HIV transmission through cosmetic services using needles. All right. There was an April 25th report, April 25 report that linked 3 HIV cases in women who received so-called vampire facials at an unlicensed medical spa in New Mexico. The procedure involves drawing blood from a client and injecting the separated platelet-rich plasma into the face. All right, so I'm gonna kind of read that again so you can get the visuals of all of this. The procedure involves drawing the blood, so they're drawing your blood. So drawing the blood from a person and separating the platelets of that blood, so injecting the separated platelet-rich plasma back into the face. So they take the blood out, separate it, and then inject that platelet-rich plasma back into the face. All right. The transmission of HIV at Spa A, or identified as Spa A in New Mexico, occurred via contaminated blood from an undetermined source. This report found the cluster of HIV infections occurred in people with no known HIV risk factors. Although transmission of HIV via unsterile injection practices is a known risk, determining novel routes of HIV transmission among persons with no known HIV risk factors is important, the report stated. The investigation tracked current and former Spa A clients who received new HIV diagnosis from 2018 to 2023. The report identified 59 clients considered at risk for HIV exposure, 20 received vampire facials, and 39 received other injection services such as Botox. The 3 HIV diagnoses were reported to the New Mexico Department of Health by clinicians. The CDC report marks the first documented cases of HIV transmission through non-sterile cosmetic injection procedures. The authors of the report say clinicians ought to consider cosmetic injection procedures like vampire facials as a possible risk factor for HIV transmission. Spa facilities offering these procedures can prevent HIV transmission through adequate infection control practices, the report authors said. Requiring adequate infection control practices and maintenance of client records at spa facilities offering cosmetic injection services can help prevent the transmission of HIV and other bloodborne pathogens and ensure adequate traceback and notification in the event of adverse clinical outcomes, respectively, the authors wrote. So, what is a vampire facial? Again, vampire facials or platelet rich plasma with micro needling is a simple, minimally invasive non-surgical cosmetic procedure performed by dermatologists and cosmetic surgeons at licensed facilities and medical spas. In many cases, vampire facials performed at medical spas may be more cost effective than those performed at a cosmetic surgeon's office. All right, so a vampire facial involves drawing blood from the client and separating the platelet-rich plasma with a centrifuge before injecting the plasma back into the face with tiny needles. The plasma is accompanied by a hyaluronic acid filler, which may result in improved skin texture and tone and a more youthful appearance. So I would also ask the question, is that worth all this HIV risk to get a youthful appearance when there's other ways you can continue to have a youthful appearance? Exercising, even though some people may not want to exercise, drinking water, eating the fruits, vegetables. Seems like it's just too much of a hassle for you to do that. And you get and run into the risk of catching HIV from these procedures. And it's not necessarily saying that even though it's a licensed facility, there's always a possibility of that still happening. See, you always got to look at it from that standpoint, because even if you go into a licensed place, you still run that risk. All right, so in most cases, vampire facials and other skin care treatments are short outpatient procedures that require little recovery time. These services are often touted as anti-aging for the face and body. PRP contains growth factors that can stimulate cell regeneration and promote healing, leading to a more youthful and radiant appearance. Farhanak Kamengar, MD, a board-certified dermatologist in Palo Alto, California. All right. He actually said this to a magazine or news source. All right. So Kamengar said the PRP with microneedling helps reduce the appearance of fine lines and wrinkles, increase collagen production, and promote overall skin rejuvenation. The procedure may also help improve acne scars, hyperpigmentation, and sun damage. Side effects of vampire facials, but vampire facials are not for the faint of heart and may come with unpleasant side effects. Kim Kardashian, who helped popularize the procedure more than 10 years ago, has said she regretted having had one. The discomfort level or pain experienced during the platelet-rich plasma, or PRP, procedure can vary from person to person. However, procedural pain is usually minimal with platelet-rich plasma, and for microneedling, we use topical anesthesia numbing cream, Kamenger explained. With the exception of mild discomfort, the side effects of vampire facials are generally minimal, Kamenger again said. These side effects may include bleeding, swelling, mild bruising, redness, and tenderness. These side effects are usually temporary and resolve on their own within a few days. It is essential to follow post-procedure care instructions provided by the healthcare professional to minimize the risk of complications, Kamenger said. So, are vampire facials safe is the question. All right. So, in licensed facilities with adequate infection control practices, these are key things to consider. Even though it's licensed, they're still saying as long as it has adequate infection control practices, like the use of sterile equipment and appropriate disinfection procedures, vampire facials and other skincare treatments using needles are generally considered safe. Generally. I always say be careful when people use words that end in ly, all right? Because you got to pay attention to them carefully, whether it's professionals or personal people you talk to. Pay attention to words that end in ly, because they can mean it's not or it is. All right. So they're saying generally considered safe. It may not be considered safe. So that generally word is kind of like all inclusive type of thing. So if somebody says, well, this happened, it was negative, well, they can say, well, it's generally considered safe. If somebody has an issue or has a issue down the road, a problem that didn't come out on the good side, they're using the term generally, the ly. Always be careful when somebody says a word ending in ly, all right? I'm kind of harping on that so you can really focus on that. All right, so generally considered safe. The American Board of Cosmetic Surgery offers guidance for finding a licensed cosmetic surgeon to best suit your needs. All right, however, less is known about the side effects of microneedling. For those who want to get microneedling, a procedure performed at unlicensed medical spas such as Spa A in Mexico. They never named the spa, by the way. So they're calling it Spa A. It just occurred in one of the spas in New Mexico. The CDC's investigation notes the New Mexico spa did not follow recommended infection control practices, thus contributing to the transmission of HIV in a handful of clients. William Schaffner, MD, professor of infectious diseases at Vanderbilt University Medical Center in Nashville, said HIV transmission in healthcare settings may occur when there are flagrant deviations from standard infection control practices. Such deviations may include reusing scalpels or needles intended for only single use. All right, so these are things you need to be mindful of and even start asking questions as they are happening. Hey, has this been used before they use it? This been used before? No, I don't want that. Or if they're not sure, then hey, go get a new one right now out the packaging. All right. So another scenario could involve inserting a needle that was used for one person into a vial of medication that's intended for someone else, thereby contaminating the vial. All right. So that's another thing to keep aware of. And then another needle, even though it's sterile, goes into that vial, but it brings up the contaminated material and then inoculate it into another patient, Schaffner explained. So that's yet another situation. All right, so beware these, keep these in mind, write them down, bring them with you if you decide you're going to have these type of procedures. All right. All right, so Schaffner told a news source of HIV transmission originates from a person with untreated HIV. It's usually not the caregiver, it's not the medical professional, licensed or unlicensed, it's almost always another patient, he explained. That almost always too is to be careful of when people use that almost always, because he's saying in one sentence that it's not the caregiver, it's not the medical professional, it's not even the licensed or unlicensed person. It's almost always the patient, the person that comes in who wants to get this done. But we just explained how some of these situations can occur, and it could be very well done by a medical professional or the caregiver, whether they licensed or unlicensed. So see, these are the games that get played. You got to pay attention to the wording and break this stuff down. All right. Should people with HIV avoid vampire facials? When performed appropriately in sterile settings at licensed facilities, vampire facials should be safe for anyone, even those being treated. All right. So this kind of like a play with the wording. The question is asking, should people with HIV avoid vampire facials? But then it says, even those being treated for HIV. All right. A lot of game playing. Just as you're better off not getting this stuff done at all. And if you want to get this stuff done, you better ask all these questions on how we explain how certain scenarios can go down. All right. So, if appropriately treated, the HIV viral load should be very low or undetectable, he explained. Appropriate infection control procedures would prevent transmission to other patients regardless of the initial patient status. Thus, there is no need to bar any such patient from these medical procedures as long as they are provided in a licensed healthcare facility that adheres to rigorous standard infection control practices, Schaffner said. So the takeaway, in a recent CDC investigation linked 3 HIV cases in women to vampire facials performed at an unlicensed med spa in New Mexico. That's the takeaway. And the procedure known as platelet-rich plasma, platelet-rich plasma, platelet-rich plasma. I'm saying it 3 times on purpose, or PRP, all right, with microneedling, involves drawing blood from a patient and then injecting the plasma back into their face. The side effects are usually, there goes that LY again, usually minimal. The side effects are usually minimal. Under sanitary conditions, in licensed facilities with rigorous infection control practices, vampire facials are generally LY considered safe, even for those with HIV. All right. So that was a lot to take in. All right. But this is something you guys definitely need to know about. All right. You definitely need to know about this in case you're going to go out there and get you a vampire facial. All right. Play this video back so you can get the information, jot down the information that you find important to you, especially those scenarios that could occur, and be aware as these people are performing these procedures on you, should you be the one that's getting it, and make sure the tools that are only for single use, ask before they start using it on you, and then make sure when they finish using on them that you make sure they throw it away. All right. So once again, we thank you for checking us out at the Pandemic News Report, and we will be back again with another one. This is the Pandemic News Report. Take care.
And now, here is your pandemic news report.